Dr. Sherin Jose, consultant dermatologist at Yashoda Hospitals, Hyderabad. Hair loss is one of the most common problems for which patients approach a dermatology OPD department. Hair loss can affect both men and women, but the psychological impact of hair loss is more on women compared to men. So today let's discuss one of the most common reasons of hair loss in women, that is female pattern hair loss. So what is female pattern hair loss? Female pattern hair loss is a progressive condition which usually begins in midlife, that is after the age of 40. It is more common in postmenopausal women, but can also have an early age of onset, that is in the late 20s or in the early 30s. So how does it present? It usually presents as a widening of the central partition of the hairline with associated loss of density on the top of the head. In women, unlike men, the frontal hairline is usually preserved, but in some cases the frontal hairline can be breached, which results in a Christmas tree pattern. And in women, it can also present rarely as a recession of the hair from both the temples. This is known as temporal recession. So now coming to the reason behind this disease, that is a female pattern hair loss, it is something known as follicle miniaturization. That is the hair follicles which usually produce thick and terminal hairs gradually over the years begin to produce thinner, lighter hairs known as vellus hairs. And this leads to the decreased density of the scalp hair. So in this disease, the patients usually do not notice much of a hair shedding from the roots, but they usually notice the thickness of the ponytail or the thickness of the braid is decreasing over the years. So this is what is characteristic of female pattern hair loss. Now coming to the diagnosis, it is mainly a clinical diagnosis, and trichoscopy can help the diagnosis in very early stages. And it has to be differentiated from other conditions like telogen effluvium and diffuse alopecia areata. Now coming to the treatment of this disease, we have to understand that this is a genetic disease, and therefore the treatment does not rely fully on the cure. The treatment is mostly aimed at preventing the progression of the disease. So the mainstay of the treatment is hair serums like minoxidil, which can help to prevent the follicle miniaturization. In patients who do not respond to topical minoxidil, tablets are given. These tablets include tablets like spironolactone, flutamide and finasteride. And in the newer treatments which include treatments like low-level light therapy and PRP treatments. And also in advanced cases which are not responding to treatment, you can go for hair camouflages like hair prosthesis and scalp micropigmentation. Hair transplantation can also be tried in some cases. So if you're a patient who is suffering from hair loss which is over a duration of more than 6 months, which is not responding to a proper nutrition and diet and hair supplements, you might be suffering from female pattern hair loss. So please do consult your dermatologist. In case of any further queries related to any dermatological issues, do reach out to Dermatology Department, Yashoda Hospitals, Hyderabad. Thank you.